Hi, everyone. I'd like to welcome you to today's session on accessibility and equity in accessing disability benefits. Before we begin today's session, I would like to acknowledge that I am joining you from the city of Gatineau, the unceded traditional territory of the Algonquin Anishinaabe people. The map you see here reflects the many Indigenous nations whose territories span across what we now call Canada. We honor them all, past and present, and commit ourselves to learning from and respecting their histories and cultures. The Pathway to Benefits project is a free national initiative led by Mood Disorder Society of Canada. It helps Canadians with disabilities and their families access the financial supports they are entitled to but too often miss out on. Pathway to Benefits is funded by the Government of Canada's Disability Benefits Navigation Program. Therefore, the views expressed here today do not necessarily represent the views of the Government of Canada. Brief introductions. My name is Diana Vince. I'm the National Program Manager at MDSC. I'm going to pass it along to my two colleagues to allow them to introduce themselves. We'll pass it along to Sherry to quickly introduce herself.
Hello, everyone. My name is Sherry Mayer. I'm the National Outreach Navigation Coordinator for the Pathway to Benefits project.
All right, Ashley.
Hi, everyone. I'm Ashley. I'm the National Benefit Navigator here at Pathway to Benefits.
Okay, now before we get started, please note that your microphones are muted. The chat will be open, so if you'd like to, feel free to use the chat. We also urge you to use the Q&A function in order to ask any questions that you may have, and we'll address them towards the end of the session. Please do not disclose any personal health information when asking questions. And a recording of the session will be shared with all registrants following the session and will also be available on our website at benefitspathway.ca. A couple of things that we are going to cover on today's agenda. For those that are new and joining us, we always do cover who we are at MDSC, what our program is all about. And for today, we're going to go over accessing disability benefits, the type of benefits, accessibility versus equity, and some of the common barriers to access. So MDSC is a national non-for-profit organization dedicated to improve the quality of life for people affected by mental health issues through advocacy, education, and support. What we do is really provide education and awareness about mood disorders to the public, healthcare professionals, and policymakers. We offer support and resources for individuals living with mood disorders and their families and advocate for improved mental health services and policies across Canada, all while promoting research and innovation related to mood disorders. Regarding a pathway to benefits, it is an initiative led by MDSC to support Canadians with disabilities and their families. We help navigation of application of the DTC, the CDB, which was launched this summer, and other provincial or territorial disability supports. Of course, the program is free. We urge people to contact us, to write to us via email. We're going to be sharing in the chat some of those ways of means of reaching out to us. We really do, base our service on providing that one-on-one navigation support. It's extremely personalized. We have various tools on our websites and resources that you may have access to as well. And we have fully trained volunteers, ready to answer any of your questions as well. The goal really for this program and for our services is to make sure that we are able to reach out to underserved communities as well. And I will now pass it along to my colleague Ashley to continue with the session.
Hi, everyone. I'm excited to start talking to you guys about the disability benefits and accessing and common barriers. Disability benefits promote dignity, stability, and inclusion. However, many Canadians, such as it might be yourself or others or somebody you might work with, still face barriers to access. Today we'll be focusing on why these barriers exist and exploring how we can improve and how we can work through these barriers. Disability, as I said before, disability benefits support independence, dignity, and inclusion. And understanding these barriers will help us advocate for better systems. Next. There are multiple different types of benefits available. The first is federal disability benefits. These include the disability tax credit, CPP disability if you have worked, or there's also the new Canada Disability Benefit that was introduced this summer. Provincially and territorially, there's income supports such as Ontario Disability Support Program or People with Disabilities in BC, Saskatchewan, or Alberta Assured Income for the handicapped. And lastly, there are community supports. These can be through municipal governments or through nonprofits that may assist with housing, medical, and employment benefits. However, because these systems are so fragmented, there are inconsistent experiences and there's difficulties accessing all levels of benefits that one might be eligible for. The difference between accessibility and equity is that accessibility removes practical barriers, creates clear info and simple forms, and allows for digital and physical access. Accessibility is allowing the access to what is needed. Meanwhile, equity goes beyond that and behind the accessibility. In order to be accessible, we need to take into account equity, such as addressing systemic disparities, making sure that criteria for these benefits are inclusive and fair, and recognizing intersecting realities like the community you're in or where you live and how that influences your access to disability benefits. Next slide, please. Common barriers to access include administrative barriers because oftentimes necessary paperwork is very long and complex and can be very difficult for an individual to fill out. Then there is technological barriers, which include inaccessible websites, PDFs that are not accessibility friendly, or not having the proper formatting for individuals with disabilities. There's also systemic barriers that include medicalized eligibility models, focusing on diagnosis over how it impacts your life. And then there's social barriers, such as the stigma of receiving disability benefit and bureaucratic fatigue, being tired of fighting to get the benefits you need. Inequity shows up through multiple different ways, such as people with episodic or invisible disabilities are often excluded or have difficulties getting what they need. Indigenous, racialized, or rural applicants face additional barriers, such as access to the internet as something so simple, or, for example, mailing takes a significant amount of time longer for rural applicants. Not also taking into account other barriers due to racialized communities or being indigenous. Meanwhile, caregivers spend hours navigating these multiple systems for both themselves, trying to receive help for their effort in caregiving, and also for the individual they're caregiving for, which can lead to burnout, which is why intersectional barriers can multiply stress and delay support that's needed. Navigating barriers is very difficult. There's no argumentation on that. In order to navigate the barriers, there are three key ideas that we need to keep in mind. The first is document. When you are trying to get disability benefits, it is crucial to document everything, keeping copies of applications, the letters that the government sends you, letters from your doctor, letters from specialists, etc. Documenting everything that you have medically is very valuable when you're going to appeal or reapply, because the most common barrier the first time around is a lack of information. You can also use advocacy and support networks and peer support. You can use our service, which is completely free. You can reach out to other disability organizations, social workers in your area, or peer navigators who might understand the system and help you with your appeals and help with anything else you might need. There are some things that, although we do help with appeals and reapplications and original applications, some benefits, such as housing or food insecurity, they might need to be taken to advocacy or peer support networks that can help locally. And lastly, you can ask for accommodations on your applications. You have the right to accessible formats, plain language, and alternative communication methods if the methods that are available and accessible are not accessible to you. Next slide. And then you can also use tools like our website, which centralizes information and filters programs based on your needs. And of course, if you have any questions, you can call us and our volunteers or text or chat while you're on the website. By doing that, you can receive information and we can help guide you and find out possible avenues and see what you might be eligible for. You can also prepare for your appeal while you are applying. Most people are approved on appeal. Persistence is often a part of the process. So, getting all that information, getting somebody behind you from the get-go is extremely important to receiving and get benefits and getting approved. Lastly, take care of your energy. Make sure that you are taking care of yourself and pacing yourself. It's very difficult applying for benefits, especially with how fragmented it can be, which is why often we will stage it and help you prioritize based on what you need. Navigating is emotionally taxing, so it's crucial that you take care of yourself and pace yourself and lean on support when you need it. Next. There are some positive changes that have been coming into play in the last few years on accessibility. There's more use of plain language and simplified processes, and there's been more introduction of accessible formats. There's a growing recognition of lived experience as expertise, and benefits are now listening to those with lived experience on how best to advocate and how to get these. And that is what our program partially is built on. We recognize the lived experience and we listen and try to make it as accessible as possible. And lastly, there are better digital accessibility standards. So if anybody has difficulty accessing forms or accessing benefit websites, it's more accessible than ever to receive this help. We even have accessibility tools on our own website that can help you or anybody get the information that they need. Next. Before we get to the Q&A session, I do have a few frequently asked questions that I will go through. The first is, what if my doctor doesn't understand my disability well enough to complete the forms? In this case, you are your own best advocate. If your doctor does not necessarily understand your disability well enough, you can go to a specialist if you have one to fill out any forms. But also, what I always recommend, because most benefits are based on impact instead of diagnosis, I'd recommend keeping a little diary and writing down how your disability affects your life and what you have difficulty doing and enumerating it. And often, when faced with this list and this understanding and seeing the impact, doctors might start getting the understanding. If your doctor still does not get the understanding, there are other resources available that might help you fill out the forms. There are online doctors and other avenues that you can explore to get your forms filled out. The second question is, what types of support can a benefit navigator provide? As a benefit navigator, I provide a array of supports. I can help determine what you might possibly be eligible for, lead you through provincial and territorial um, benefits and any income supports. I can help guide you through the forms and walk you through any federal disability, such as the disability tax credit or the Canada Disability Benefit. I can answer any specific questions that you might have. Often, I also can work with people to start a plan and help them get all the benefits they might be eligible for. I can help prioritize based on what you need, and I can give some tips and tricks on getting approved. And I can send any information that you need. I am basically an encyclopedia for disability benefits. And if you need any extra help, I have no issues finding the answer for you or finding a local resource that might best help you. Lastly, for this slide, for the frequently asked questions, is how does Pathways to Benefits support accessibility and equity? First of all, we make access to information especially easy. Our website is easy to navigate. It's accessible. We have accessibility to the hilt, and we ensure that any information that you might need is on our website that you can just check. We also offer a variety, as I've said multiple times before, we offer a variety of ways to contact us. You can contact us through text, through chat, through phone, and through email. No matter how you choose to contact us, we can provide assistance in both English and French to ensure that there's accessibility and all your questions can be met. I also have a few more questions. So what if I don't have a computer or struggle with online forms? When it comes to online forms, the good news is that often there are paper versions available. It can be very difficult and time consuming to go through the computer or go through the steps needed. However, the government will often mail you forms that you need if you do not have a computer or struggle with online forms. You can also, for example, go to the library. They may help you print it out, or there might be local organizations that can help print out and help you personally fill out the form. There are a lot of different options that you can take, but getting the form is not a barrier. How long does it take to get a decision? That depends on which benefit that you are applying for. Some can take 2 weeks, others can take 12 weeks. Right now, the disability tax credit is going 12 to 16 weeks for their application. But when you look at the Canada Disability Benefit, that is a very quick turnaround and quick application once you have the disability tax credit. And often the provincial benefits also can be very quick. So it is all basically a matter of what you're applying for, but the longest you'll wait is approximately 16 weeks for a decision. Can caregivers get support too? Yes. There are a variety of caregiver assistances available. For income assistance, caregivers can be eligible for EI caregiving assistance, and also there's a caregiver tax credit that you can apply to your taxes and possibly get a larger refund. There are many different options and avenues for caregivers to get support. How can I make sure I'm not missing benefits I qualify for? This is very difficult. Because there are so many benefits. But luckily, that is part of the service we provide is you can call us and we can see if there's anything else you might be eligible for. Or if you're comfortable, you can use our website and also just keep up to date using news sources online on what is coming up and being offered because there are new disability benefits coming into account quite often. When you're looking online, it is crucial to use sources that you trust and not necessarily just links from different websites or that pop up. There are a lot of different scams and information that is circulating that might not necessarily be the truth. So it's very crucial to be careful of the information that you're receiving online. And our website and calling us is a very good way to make sure that you're getting the best information possible.
I think we can move on now to the Q&A. I don't see any questions that are currently in the Q&A.
Mhm.
I urge anyone to either raise your hand, you can ask questions live, you can throw them into the chat for us to address them, or put them into the Q&A. If you don't have until some of the questions do come trickling in, or if they don't, that's quite all right. We do have a few other questions that we have as frequently asked that Ashley can go over.
What if my disability isn't visible or it fluctuates? Invisible disabilities are a big barrier, as I went through before, but government programs are now recognizing invisible disabilities, and as long as you meet certain criteria on how your disability impacts your life, even if it fluctuates, often you can get benefits. And it's a matter of getting your doctor to fill out the forms. And if you have any questions, like I've said multiple times before, feel free to call us on that. Do I have to stop working to qualify for disability benefits? And the answer is no. Most income sources, you are able to work up to a certain amount of hours, or you're able to have a certain amount of income. So you don't have to stop working if your hours are cut. But also, if you are full-time and not eligible for income sources, the disability tax credit is still a very good benefit for you to have. It helps you with your tax returns and it can help save you money in the long run. And through the DTC, you can also get the Registered Disability Savings Plan, which helps you with saving and can get you government matched savings. So having the disability tax credit if you're working is a very good thing to have. Lastly, do I have to pay anyone to help me apply? I've seen companies charging fees. The answer is no, but also it depends. We do not charge any fees to help you navigate and apply. If you're looking for your doctor to fill out forms, you might possibly get charged for the extra time it takes for the forms. The average cost I found is about $60 to $100 to get forms filled out by your family doctor. But you do not have to pay anybody to help you apply or to apply. Um, Anything regarding this, you can easily do for free, and we also offer services for free as well. I do
Great.
see a question in the chat. Do you offer other language services slash translation beyond English and French? Right now, we do only offer English and French. Our volunteers, we often have a French speaker on call, but possibly with more volunteers, we might start to expand. But as of right now, we only offer English and French.
I don't see any other questions. And not to worry, we know it's the month of December, so we can have a shorter session without issue. I know some of you might already be feeling the holidays creeping up on you. I have included in the chat a link really to get your feedback. We do one at every session. We'd love to hear what you think about the sessions, and it's really through the feedbacks, surveys that we're able to grab some of the topics that you might be interested for us to cover, or any ideas really on just making sure that we are able to provide the best service. That would be the place to share any thoughts you may have. The session, of course, that you were at today is being recorded. So all registrants will get a copy of the recording within a week or so. We'd love to invite you to our next session, which will be held on January 28th. It will be on appealing a DTC application, your options and your rights. I have included in the chat a registration link inviting all of you, of course, to register to our next session. Once again, I'd like to thank Ashley and Sherry for joining me today. And on behalf of all of us, we'd like to thank whoever has joined us on our session today for taking the time to be with us. We wish you a lovely holiday season, and please don't forget, visit our website, benefitspathway.ca, 1-888-975-9990, or you can email us at any time, info@benefitspathway.ca. If it's more convenient, we also have a chat available online on our website, so feel free to chat with us. We're more than happy to chat away and answer any questions you may have. Thank you so much, everyone. Have a wonderful rest of your day.